In today's PowerPoint, we are going to see about the drugs which are used in diabetes mellitus. So, diabetes mellitus, as we all know, type 1 as well as type 2. So, today's PowerPoint is about drugs which are used in type 2 diabetes mellitus, which is otherwise called as oral hypoglycemic drugs. So, we are going to see about the different group of drugs which are used in type 2 diabetes mellitus to treat the main condition hyperglycemia. So, they are called as oral anti-diabetic drugs or oral hypoglycemic agents or anti-hyperglycemic drugs. Why we need these group of drugs? So, insulin is the best choice available for treating diabetes mellitus. For replacing insulin deficiency, we can give insulin. Why we have to go for these group of drugs? Because of certain condition. The first thing is insulin is orally not effective. The second one is it has to be given by subcutaneous injection. The third one is cost. So, mainly because of these reasons, we go for OHA, that means oral hypoglycemic agents. The main reason for type 2 diabetes mellitus is two conditions. One is beta cell dysfunction and another one is insulin resistance. In type 2 diabetes mellitus, we can't say insulin is not there. Insulin may be there, but insulin is not efficient for producing the action. That means the resistance occurs in the muscles as well as adipose tissue. So, the intake of insulin is not proper. The sensitivity is not there. Because of that, it may lead to insulin resistance. So, these are the two reasons. Beta cell dysfunction as well as insulin resistance are the two reasons for type 2 diabetes mellitus. So, ominous effect is a thing mainly referred for hyperglycemia or diabetes mellitus. So, why that hyperglycemia occurs? It may be due to 8 factors. The first may be due to decreased incretin effect. So, we will be studying in detail about incretin in the later stages, later slides. Just we have to understand what is incretins. Incretins are the substances which are released in our body when glucose is taken. That means when glucose or nutrients are taken, automatically they release this incretins that stimulate the insulin secretion. So, if the incretins release is blocked or if the incretin release is not proper, that may lead to hyperglycemia. Increased lipolysis, breakdown of lipids. If breakdown of lipid occurs, that leads to free fatty acids as well as triglycerides, and that may lead to hyperglycemia. And the third reason is increased glucose reabsorption. In the kidneys, nearly 900 milligram of glucose are coming to our kidneys daily. So, most of the glucose are excreted from our body. If it gets reabsorbed, that means it reabsorbed back by our body from the nephrons, that may also raises the blood sugar level. And the fourth reason is decreased glucose uptake. In the skeletal muscle, if glucose is not utilized properly, that will lead to hyperglycemia. Neurotransmitter dysfunction. If the hypothalamic drive is stimulated, there won't be any satiety. Satiety means the feeling of fullness. So, mainly because of that, the intake of carbohydrates will be more. That may also lead to hyperglycemia. And increased HGP, that means hepatic glucose production. In the liver, gluconeogenesis occurs. Breakdown of glucose, glycogen occurs. That means glycolysis occurs and gluconeogenesis occurs. Breakdown of glycogen and production of glucose. That may lead to hyperglycemia. Another reason is increased glucagon secretion in the alpha cells. That lead to hyperglycemia. And decreased insulin secretion, the major reason from the pancreas. That also lead to hyperglycemia. So, these are the different effects that leads to hyperglycemia and diabetes.